Thank you very much, Mr. Anuga. Good morning to everybody who's attending this colloquium organized by Percon. We have heard from our colleagues, namely Mr. Trivedi, Mr. Das and Mr. Mishra, about the various, approaches to the disease processes, their possible effects, their preventive measures, the possible solutions. But mainly they have been, the industrial sort of diseases, then mental wellness, lifestyle diseases, etc., etc. But at the outset, I would request you to kindly pay attention to the broader spectrum of the disease prevalence. The disease caused by today is not only because of that. It is primarily because of the infections which are occurring in our community. It could be, the infection could be a bacterial infection. It could be a viral infection. It could be a rickettsial infection. It could be a parasitical infection. And the glowing example of this infection as on today is the COVID-19 pandemic, which is sweeping across the globe. If we go into the pandemics which have ravaged the human mankind, I would like to attract your attention towards Spanish flu, which started somewhere in 1918 and ended in 1920. It was there for almost 2 years. I can assure you there was no medicine available for treating this pandemic. What people did then are the same methods or same modalities or the same preventions are being adopted today for the pandemic of COVID-19. So in other words, if I take this as an extension, we do not have a definite treatment for COVID-19. We only have certain preventive measures to block its transmission. And as pointed out earlier, you must have noticed. Hello. Am I audible? Am I visible?
Yes, you are audible.
Okay, fair enough. So if you see I would like to take your thoughts process. Few months ago, there was some kind of friction point between Indian Foreign Office and administration of the Donald Trump on a piddly little medicine called chloroquine. They expect Dr. Anthony Fauci said the pandemic can be treated, this disease can be treated by chloroquine. So there was some problem in shipment of this drug to that country. But today, I'd like you to inform that the hallmark of the treatment modality or the medicine for this particular pandemic, the drug called remdesivir, has been rejected by the doctors for its treatment. So in other words, what I'm trying to tell you is there is a continuous process of evolvement of the disease, the continuous process of the treatment of the disease, and as we are passing into the time, we are learning about that disease. And about 3 or 4 months ago, Dr. Anthony Fauci, the advisor to the President of the United States of America, made a very famous statement. Gentlemen, we know nothing about this disease. So the status hasn't changed. It has, of course, caused a lot of problems in production, GDPs, etc., etc. Human man hours have been lost, morbidity and mortality has been lost, and India is in technical recession because 2 subsequent quarters our GDP has contracted. So there you are, sir. Now I'd like you to concentrate on this disease itself. The offices and other workplaces are in the closed setting. And the shared spaces like corridors, elevators, stairs, parking places, cafeteria, meeting rooms, etc. And thus COVID infection can spread relatively fast amongst officials, staff and visitors. So there is a urgent need of preventing the importation of the infection in working place, so that a suspect case of COVID-19 is easily detected or suspected, so as to limit the spread of the infection. The onus totally is on the blocking of the transmission of this particular disease and giving the patient the supportive treatment modality to overcome the disease by his or her immunity and fighting potential of the body to combat this disease. So we present you a document which outlines the preventive and response measure to be observed to contain the spread of this disease in workplace setting, like basic preventive measures which need to be followed at all times. Secondly, measures specific to the offices, measures to be taken on occurrence of the case, and disinfection procedures to be implemented in case of occurrence of suspect oblique confirmed case. Now the basic preventive measures are simple public hygiene measures which need to be followed in case of to reduce the risk of this COVID infection, like physical distancing. Now, physical distancing, it can be 1.5 meter or 2 meter or 3 meter, but it has to be in a manner. It has to be done in a manner that your breath does not hit the person you are facing, so that the transmission of the disease can be blocked. Use of covers and mask is mandatory. And again, the diameter of the pore of the mask is of importance. All these viruses and these infective material has to be confronted with a mask with pores diameter of 0.3 micron. The problem with the reducing of the diameter of the mask is, in case you reduce the diameter of the pore of the mask further, your normal respiration will be labored. Work of breathing will increase, and that is detrimental for the health. But in case you increase the diameter of the pore of the thing, the very purpose for which it is being used will be defeated. Then respiratory etiquettes and the self-monitoring of the person who should be made aware of the disease of prevalence, and guidelines have been issued by the Government of India, Ministry of Health and Welfare. I would request Ms. Anubha to display the link for this particular guideline protocol.
It's already there.
Already there.
So any staff reported suffering from the flu-like illness should be allowed not to attend the office maybe at the organization's cost. And any staff requesting home quarantine based on containment zone visitors in their residential areas should be permitted for work from home scenario. And DFOT guidelines are available with respect to organization meetings, coordinating visitors, etc. Next step is the measures to be taken on the occurrence of the case. Despite taking all these preventive measures which we have enumerated or which we are getting accustomed to now because of the evolvement of the disease, the infective cases will come. The people will suffer from this particular disease till such time our immunity levels are augmented to a level where we can ward off the ill effects of this disease. Maybe by vaccination, maybe by herd immunity, or whatever method you need to adopt for the blockage of the transmission of the disease. Now, the measures required for the organization in case of occurrence of this disease should be enumerated in the following sentences. Place the ill person in a secluded room with a mask and inform the local health authorities. They have the rapid response teams made in the district headquarters under the flagship of CMO's office to attend to such emergencies. And then there is a helpline number also available for the whole of India as 1075. A risk assessment will be undertaken by the designated public authority, and the suspect will be having either mild symptoms or the major symptoms. I'll just enumerate you the protocol under which you can classify the diseased person. The concept now the classification of the diseased persons. Contacts are the persons who have been exposed to a confirmed case anytime between 2 days prior to the onset of the symptoms in the patient in the positive case and date of isolation to a maximum of 14 days. High risk contact, touch body fluids, patient's respiratory tract infection, blood, vomit, saliva, urine, feces, etc. had direct physical contact with body of the patient, including physical examination without gloves and PPE kit, touched or cleaned linens, clothes or dishes of the patient, etc., etc. And low risk patient is shared the same space, worked in the same room, but not having high risk exposure to the confirmed case, traveled in the same environment. To give you a rule of thumb, if you come in contact with even in the known patient for less than 15 minutes and share the same room and the same car for less than 15 minutes, you are a low risk. You're not a high risk. Now I'll come back to closure of these management of the minor cases and major cases, major risk cases has been given in the management of the contact. There are links available on the slide which can be followed. Now the closure of the workplace. If there are 1 or 2 cases reported, the disinfection procedure will be limited to place areas visited by the patient in past 48 hours. There is no need to close down the entire building, halt work in the areas of the office. The work can be resumed after disinfection process is completed as per laid protocol. However, if there is a larger outbreak, the entire building will have to be closed for 48 hours. After thorough disinfection, all the staff will work from home till the building is adequately disinfected. Now I'll draw your attention to the disinfection process to be followed in the offices. There are detailed guidelines available. The whole guidelines, if I start enumerating, it will take a lot of time, but for your convenience, a link has been provided in the slide above where a disinfection process can be followed in the office. In the end, I'd like to talk about little bit about the vaccines which are forthcoming. There is a vaccine which is available in America. There is a vaccine which is going to be used by NHS in UK. Then there is a vaccine which is available on the European continent. Even India is also in the fairly advanced stage of developing its own vaccine. We do not have access to the Chinese vaccine, but Russian vaccine has been made available to us, and hopefully the inoculation will start by the end of this year or maybe start of the next calendar year. But a word of caution about these vaccines, though they are claiming a success rate of 90%, 95%, 100%, but you see, till such time these vaccines are not used on human bodies, their results are not available to us, it will be very difficult to say how successful this vaccination problem or program is going to be there. So in the end, I'll wish human race all the best with the help of these vaccines if they develop adequate immunity and the disease is won over. I have finished talking on these places. I would request you to kindly ask me any questions if you have related to my area of discourse.